Hello, this is Bill O'Leary and with Mission Veterinary Clinic, and today I'd like to talk to you about client correspondence and communication. Um, I think the best way to do this is to just show you some examples. So I'm going to open up a client here. I'm going to go to the upper left-hand corner and click on that little clipboard there. I am going to open up client number 3, which is William O'Leary, and I am going to go to his patient, test 5, and I'm going to left click on it. And then I'm going to right click and drop down to the Correspondence tab. Now, as you see here, I have some favorites created. Every employee can have their own individual favorites. You just have to let me know what you want them to be. But let's pretend the form I'm after is not in the favorites. I'm going to click on All Correspondence. I'm going to enter in my staff ID and tab and go to All Categories. Now, MVC, Mission Veterinary Clinic, those are the main categories we're after. And I'm going to go through those categories real quick and just show them to you. First, approve, sign, and decline. Those are all forms that approve, sign, or decline something. And if I double click on any one of these, it'll open in a full-size window. So we have a health certificate, anesthesia, animal remains release, comprehensive, pet history, etc. We go through several different forms. We have certificates. This shows our rabies, our spay-neuter, and our vaccine certificates. If I double-click on any one of those, it'll open in full size. Client information sheets. These are informations on all kinds of different conditions that our patients could have, and these are just general forms we could give to our clients to help educate them. Many times the clients are very overwhelmed, so they don't hear what we say. Many times English isn't their first language, so they're having trouble understanding what we say. And by giving them something in writing, that really helps. We can also make them sign for those forms, so there is a signature on file. So if I open one of these, well, probably one of my favorites is Parvo. Let's see, do we have one here on Parvo? We should. Here we go. Parvo Fax. We see a lot of Parvo. So I could double click on this. And if we scroll to the bottom, there is a spot for a client signature. So if in the room we click on this pen and we have the client sign for it, now it won't allow me to do it here because there's no signature pad connected to this computer, so it's going to fail. But if there was a signature pad, they would sign. It would auto finalize. HS description is Parvo Fax. Probably should have information sheet, but that's okay. We'll just finalize this form so I can show you what happens. It has not been signed. Yes, I still want you to continue like it has. Move this off to the side. Oh, we'll just close it. And you can see over here now, with test 5 chosen, Parvo Fax Final is there. If I had double click on that, if we had a signature, we could view the signature. That way, if someone calls up later and they're upset, no one explained to me how deadly it was or what the symptoms were, anything, the technician or the manager on duty, when they look and see this, they will know that that information is not accurate, that we actually explained it to them, we gave them an informational sheet on them, and we had them sign for it. And that signature would show down here under client signature if they had signed for it. And we'd have it forever. And that is a great way to protect ourselves and to make sure we know what's going on within the hospital. Let's go back to that correspondence and look at some other options. I'm going to click All Correspondence. Once again, put in my staff ID, all categories, client information. There's client emails. These are different emails, and I can create more that we send clients. Most of these are on lab results because if it's a positive for a parasite like Coccidia, Giardia, roundworm, or tapeworm, we can just send them an email letting them know. I'll open one of these so you can see it. And it automatically populates the pet's name. It automatically populates test 5 lab results have come back positive for Coccidia, and it sends them the basic information on what they need to do. So they get that email. That way, if they're not answering the phone, they're not getting the doctor's phone number, phone calls, they're getting an email as well. They're permanently in our records. So if they call up a week or a month later saying no one called me, well, we did call you and we also attempted to email you the results. Okay, and those would need to be finalized after they were emailed so they are permanently in the record. I'm not going to save the changes on this. And I'm going to go on to go home instructions, my favorite section, and the one I think we should be using the most, especially when animals are hospitalized. I think every hospitalized animal should go home with some go home instructions, and I think every client should have to sign for those go home instructions when they pick up the animal. That way, if we do get a call back later, um, and it's a common call that no one explained anything to us, Danny or I or whoever is talking to them is able to immediately go look and see that there's some go home instructions there and they're signed for. And not only did we explain it to you, but we gave you some written instructions that you signed for. And let's just go through and choose one of these. Laceration repair. The great part about these is you can open this and the doctor or the technician can modify this on the fly so she can get in there. Please keep test 5 indoors for the next 7 to 10 days. Oh no, I want to change that to 20 to 25 days. No running or jumping for 10 to 14 days. No, let's change that to 20 days. The doctor can modify this on the fly. Anesthesia may still be groggy. Oh, I just want to delete that altogether. Not a problem. Very easy to do. Finishes and saves it. Yes, I want to save it, but I'm not finalizing it, so it can still be edited. Click OK. Sorry. So we close this. And then I want to go somewhere else and show you all the correspondence docs. If we go up here to the daily planner, okay, well, first of all, we can see the laceration repair discharge instructions right here in the bottom summary. Okay, and they can be opened there at any time. Just double click, open them right up because they're tentative. If they were finalized, they could not be edited. They can be opened and viewed, but not opened and edited. Because they're tentative, they can still be opened and edited. Any point in time, they can also go to this daily planner, which is the suitcase in the upper left-hand corner with the red cross. We can left click on that and we can go to correspondence and we can see all the correspondence that are sitting there that are tentative that clients need to sign for. Now, because it's under a William O'Leary, it's only showing the ones that William O'Leary created. But if we go view for all staff, now all of the tentative correspondence documents in the hospital are sitting here. Let's see, what do we have here? We have the one I just made. We made to get together. Oh no, excuse me. Test is the bottom one. Then here we have patelloluxation is created by Gabriel sitting there. We have a surgery discharge from Jeanette. We have something from Andy, a mass removal discharge. Great. So people are making these discharge instructions already. When the client comes in, we should either up front or wherever there's a signature pad, have them sign for that. And we do that by simply going to it at a computer where there is a signature pad and opening the form. I'm going to double click to open it. Coming over here, clicking client signature, and if we were connected to a capture device, the capture device would open right here. The client could sign for it, and their signature would be permanently placed right here. This would automatically be switched to finalized when they signed for it and saved. Okay, I'm going to finalize it manually. Save. It's telling me it's not signed. Yes, I still want to finalize it. You can also print and give a copy to the owner. You can email a copy to the owner. I suggest you doing both. Why not? Let's email and print, cover all of our bases to have the best communication possible. Close this window here, and if we come here, now it still shows tentative. I want to right click, go update. That's not what I wanted to do. I want to go up here, right click and go refresh. Actually, forget it. That is a different, that's a laceration repair discharge instructions, which now turn final. And here is our parvofax, which is final. Okay. So it just needed to be refreshed to finalize, but now it is finalized in the summary, in this pet summary right here, and it will be there forever. So if at any point in time they ever call back and go, no one explained this to me, we can immediately go to the laceration repair discharge, double click, see their signature, and go, I'm sorry, Mr. O'Leary. It looks like not only did they explain to you, they actually had you sign a form and they gave you a copy of these. Would you like me to re-email you those instructions? So I hope that helps, and I hope we can use that to have better client communication with our patients and our clients. Thank you.